Not to scare you or anything, but do you know that proteinuria can significantly increase the chances of heart attack, stroke, diabetes, kidney cancer? This means that getting rid of it or significantly lowering it is one of the most important steps in lowering your risk of many deadly chronic diseases. Although it may sound simple, protein in the urine, knowing what causes it in the first place can assist you in taking steps that will help you recover from it successfully. Trust me, treating it is a little bit more complicated than just taking certain drinks or herbs. In this video, we are going to talk about what causes proteinuria and 8 actionable hacks that can help stop proteinuria and heal your kidneys fast without using medications. By knowing all this, you will know that just increasing your water intake will not magically stop your proteinuria like many people assume. Before we get started, please like the video and subscribe to the channel if you haven't already. Causes of proteinuria. 1. Dehydration. When your body loses an excessive amount of fluid, it leads to dehydration. Water is essential for delivering nutrients, including proteins and other vital substances, to the kidneys. Without enough water, blood flow is impaired, and the kidneys cannot properly reabsorb proteins, resulting in protein being excreted in the urine. Dehydration often causes mild proteinuria, which can happen as a result of other factors like stress, fever, or exercise. This type of proteinuria is usually not dangerous and may resolve on its own. Increasing your water intake will help in clearing out your proteinuria if it's a mild one, and caused by dehydration, not if it's caused by the other causes we will mention later. 2. High blood pressure. High blood pressure is another primary cause of protein loss. When blood pressure is elevated, the kidney's membrane can't withstand the pressure, leading to a significant amount of protein being released into the urine. 3. Diabetes. Diabetes damages the membranes of kidney cells, impairing kidney function. Due to this damage, a significant amount of protein is lost through the urine. 4. Glomerulonephritis. Glomerulonephritis causes proteinuria by inflaming the kidney's glomeruli, which disrupts their filtering function. This inflammation can increase membrane permeability, impair the charge barrier that normally prevents protein loss, and reduce the overall filtration capacity, allowing proteins to leak into the urine. 5. Autoimmune diseases. Autoimmune diseases can trigger proteinuria by causing damage to the kidney's filtering units due to the immune system attacking the body's own tissues. 6. Chronic kidney disease. Chronic kidney disease, CKD, causes proteinuria by gradually damaging the kidney's filtering units, called glomeruli. As CKD progresses, this damage worsens, leading to increased protein leakage into the urine. If untreated, CKD can eventually lead to kidney failure. 7. Cancer. In severe cases, proteinuria may result from cancer. Cancers like lung, colorectal, breast, have all been linked to elevated levels of urinary proteins. Now we are going to talk about 8 actionable tips to stop proteinuria and heal your kidneys fast. 1. Avoid sitting for long hours. Findings from one study published in 2022 indicate that sitting for long periods at work is linked to a higher risk of various kidney problems, including proteinuria, chronic kidney disease, end-stage renal disease, and higher chances of death from any cause or kidney-related issues. This is why it's important to regularly take breaks from sitting by setting reminders to stand up and move around every 30 minutes to an hour. Consider using a standing desk or alternating between sitting and standing throughout the day if possible. Incorporate movement into your routine by taking short walks during breaks or lunchtime, as even a few minutes of light activity can help. Stretch regularly to keep muscles active and promote blood circulation. 2. Include more fiber in your diet. Including more fiber in your diet can help manage proteinuria and support kidney health in several ways. High-fiber diets are known to reduce systemic inflammation, which can alleviate stress on the kidneys and help reduce protein leakage. Additionally, fiber helps regulate blood sugar levels, reducing the risk of diabetes, a major cause of kidney damage. Dietary fiber can also help lower blood pressure, decreasing the strain on kidneys and improving their function. Furthermore, fiber promotes a healthy gut microbiome, which can indirectly support kidney health by reducing the production of toxins that kidneys need to filter. To incorporate more fiber into your diet, focus on consuming a variety of fruits, vegetables, legumes, whole grains, nuts, and seeds. But be careful to not consume too much foods that are high in potassium and phosphorus, as they are bad for weakened kidneys. So make sure to avoid foods like avocado, dairy, brown rice, sweet potatoes, and the likes. 3. Lower your protein intake. High protein, low carb diets are popular, but too much protein can cause your body to leak protein into your urine. This issue is even more serious if you have diabetes, high blood pressure, or kidney disease. There is no exact definition for a high-protein diet, but studies suggest that eating 1.68 grams of protein per kilogram of body weight each day can increase protein levels in your urine. Research also shows that eating less protein or following a low-protein diet can significantly reduce this protein leakage. The recommended daily protein intake is 0.8 grams per kilogram of body weight, which is about 56 grams for adult men and 46 grams for adult women. If you are consuming more than this amount, reducing your protein intake may help lower the protein levels in your urine. 4. Control blood pressure. Like we mentioned before, high blood pressure is one of the major causes of proteinuria. By lowering blood pressure, the kidneys are under less stress, allowing them to function more effectively and reducing proteinuria. To naturally lower blood pressure without medication, focus on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and low-fat dairy while reducing salt intake and avoiding processed foods. Engage in regular physical activity, such as brisk walking, jogging, swimming, or cycling, for at least 30 minutes most days of the week. Maintaining a healthy weight also reduces the strain on your heart and blood vessels. Incorporate stress-reducing techniques like meditation, yoga, deep breathing exercises, or mindfulness into your daily routine. Additionally, limit the consumption of alcohol and caffeine, as both can contribute to high blood pressure, and quit smoking, which damages blood vessels and raises blood pressure. By adopting these natural methods, you can help lower your blood pressure, which could in turn significantly lower or stop your proteinuria. 5. Control diabetes. If you have diabetes, try to keep your blood sugar at normal or near normal levels. But how can you do that? To manage blood sugar levels without relying solely on medications, focus on a balanced diet rich in whole grains, lean proteins, and vegetables, while avoiding refined sugars and processed foods. Choose low glycemic index foods, control portion sizes, reduce sodium intake, and stay hydrated. Regular exercise, including both cardio and strength training, helps improve insulin sensitivity and control blood sugar. Manage stress through mindfulness practices like meditation, yoga, and ensuring adequate sleep. Monitor your blood sugar levels regularly and keep up with doctor visits for necessary adjustments. Consider natural remedies such as herbal supplements, e.g., cinnamon, berberine, and omega-3 fatty acids, but consult your healthcare provider first. Maintaining a healthy weight through diet and exercise, limiting alcohol, and quitting smoking are also crucial for overall health and better management of diabetes and proteinuria. 6. Limit salt intake. Eating too much salt can cause high blood pressure and kidney damage, leading to more protein in your urine. A study showed that people who ate more salt had worse kidney function and more protein in their urine compared to those on a low-salt diet. High salt intake also raises blood pressure, which makes the problem worse. Other research suggests that cutting down salt from 10 grams to 5 grams a day can reduce the amount of protein in your urine. The 2020 to 2025 dietary guidelines recommend eating even less salt, advising less than 2.3 grams per day. 7. Avoid or limit NSAIDs use. Research has shown that high doses of NSAIDs, like ibuprofen or naproxen, can lead to kidney problems in older people. One way this happens is by affecting blood flow to the kidneys. Another way is by causing inflammation in the kidney tissue, which can show up as increased protein in the urine. This is why it's extremely important to avoid NSAIDs used unless recommended by your doctor. 8. Drink sufficient water. Adequate water intake can alleviate proteinuria caused by dehydration. When the body lacks sufficient water, urine becomes more concentrated, potentially leading to the excretion of proteins. Ensuring proper hydration helps maintain kidney function by keeping urine diluted, reducing the likelihood of proteins being excreted unnecessarily. And there you have it. If you enjoy this video, please give it a like and subscribe to the channel. Also, you may want to check out this video on 14 early warning signs you have a kidney disease.